heard this morning a little bit about context and the background, the history of this issue that we're trying to talk about today, and then started exploring more locally some key examples where systems are looking at themselves and reinvesting and thinking about how to make a difference or impact lives further upstream. We're going to continue that conversation. I am going to invite at this time to introduce her panel, the moderator for the Clean Energy Financing session, Mary Pittman, who is President and CEO of Public Health Institute. As you know, Mary's done a lot of work around community health improvement with specific attention to inequities in vulnerable populations and focus on quality care. So in keeping with how we've done things, I know it's after lunch and we probably have about an hour and a half before we start getting that postprandial lull. I'm going to ask you to go ahead and welcome Mary as she comes and she introduces her panelists.
Thank you so much. I have an illustrious panel, and I'm going to need my timer because I know they all have a lot to say today. So my name is Mary Pittman. I'm president of the Public Health Institute. And for those of you who don't know the Institute, we've been around for 52 years, and we were one of the first and largest nonprofit freestanding public health institutes, and we're part of a national network of public health institutes that are now in 40 states. So we're very excited that these institutes are able to work on some of the issues that we've been talking about at this Population Health Roundtable. PHI, I like to call it a think tank, a do tank, and a policy tank. We do research. We take that research to an evidence base that can be used in practice and also in policy. And I was a little daunted when Alina asked me to moderate this panel because I don't really know very much about clean energy. And if you go back to our goals for the day, we wanted to look at the financing in some other fields outside of public health, outside of population health, outside of our comfort zone of areas that we're well versed in. So I had to spend a little time reading the articles that my panelists gave me, and I have to say some of them were a little tougher than others to get through, but I appreciated the background. Let me introduce my three panelists and tell you very briefly what they said they were going to talk about, and then share 7 points that very quickly that I pulled from their articles that I think relate to the work that we're doing on this Population Health Roundtable. Our first speaker will be Michael Buddakan, and Michael is the president of the National Housing Trust. And I know you have a richer set of bios in your materials, and so I'm not going to go into any greater detail, but they all have very interesting backgrounds. And Michael's going to talk about the health benefits of affordable housing, some of the challenges in financing those properties, and some of the unusual funding streams that they've been able to pull together. Our second speaker is Holmes Hummel, and Dr. Hummel is a principal with Clean Energy Works and will be examining aspects of financing energy efficiency and how that affects access and participation in the clean energy economy. And our third speaker is Joel Rogers, and Joel is the Sewell Bascom Professor of Law, Political Science, Public Affairs, and Sociology at the University of Wisconsin-Madison and Director of COWS. And I have to say, I had to Google and see what COWS was, and I'm sure you'll hear more about that. I thought maybe he had an appointment in agriculture as well. Joel's going to review the unrealized economies of efficiency and renewable energy and ways to finance the expansion of both. So as I read their articles, there were a number of crossovers from the energy and housing sectors and how we might think about restructuring resources and the flows that we might apply in health. Really what I found were some of the similarities and some of the unique ways that they frame the issue. For example, in the International Energy Agency's report, I was struck by the fact that they talked about benefit-cost analysis. And in healthcare, we're always talking about cost-benefit analysis. We put the cost first. And in their case, they're looking at the benefits first, which really, their use of tools and the framing of how the outcomes of those tools is very explicit to reduce bias against energy efficiency. So I thought that was interesting. Similar to health, the articles showed that data are lacking for the positive impacts of energy efficiency in the public sector, and we're often struggling for what is the data set, what's the benefit from prevention and population health. A third similarity was in the short-term variables for tax rates and the lifetime benefits for health efficiency. So it's the mismatch between the incentives and when you're actually going to see the outcomes, which we struggle with all the time in population health. The next one was the direct links in one of the articles between indoor and outdoor air quality and the multiple factors that had to be addressed simultaneously to be able to get the benefits, one of our challenges of siloed thinking. And then finally, the similarity in terms of the local requirements, the different local assets, the local structures that made you refine your approach from a generalized state, national approach down to how you actually implement at the local level. So I look forward to hearing more from our panel, and Michael, we'll have you start.